Nia is expecting a baby. During the first 10 weeks of pregnancy, Nia is offered screening for sickle cell and thalassaemia. It is best carried out as early as possible, usually between 11 and 13 weeks, but can be done at any stage of pregnancy. These are conditions which can run in families and can be passed from parents to children. They affect how blood carries oxygen around the body. Screening is your choice. Nia can decide which tests, if any, are right for her. A sample of blood is taken from Nia's arm. The baby's father may also be offered a test. If both parents are carriers, this means they don't have the condition, but there's a chance they could pass it on to their baby. A midwife will explain the results and go through Nia's options with her. For more information or support, speak to a midwife or doctor.